which ultimately constitute of a wax. It is a protective in nature, antiseptic. Okay. So relations of the external auditory canal. Superiorly we have the middle cranial fossa. From here we can easily understand. Superiorly to it is a middle cranial fossa. Inferior to it is, here is we have parotid gland. Okay. Superiorly middle cranial fossa, inferiorly parotid gland. Anterior is temporomandibular joint, posteriorly is mastoidea cells in the facial nerve. Okay. So next we have to learn about the tympanic membrane. Tympanic membrane, it's important. I have listed here few important things. Shape oval, color pearly white, thickness is about 0.1 mm, very thin membrane. Area, total area and effective area. Total area is 85 to 90 mm square and effective is just 45 to 55 mm square. So what we mean of the effective area means which area vibrate, the actual tympanic membrane which vibrates on getting the ear sounds, sound waves basically. Angle is 45 degree. It is not vertically oriented, it is at an angle, that is 45 degree angle. So it has two parts, pars tensa and pars flaccida. Pars tensa, a unique point of this is annulus. Periphery, thickening of the periphery to form a fibrocartilaginous ring is present in the pars tensa, not in the pars flaccida. So in this we can see it's pars tensa where annulus is there, this thickening, and not seen in the pars flaccida. So next to it is, we have three layers basically, outer, middle and inner. Outer is made up of epithelial layer. Middle is fibrous layer which have three type of fibers: radial, circular and parabolic fibers. Important to note here is pars flaccida is thin and not organized into various fibers. That radial, circular and parabolic fibers are not seen in the pars flaccida. Okay. Next layer is, inner layer is mucosal layer. Easily learn, outer is the epithelial, inner is the mucosal. Middle is made up of fibers, radial, circular and parabolic. Pars flaccida is thin, not organized into various fibers. So here I have drawn a diagram. There is radial fibers, circular fibers, this revolving around, this is parabolic fibers. Next to it we have, it's very important diagram of the tympanic membrane. First draw in the oval shape, then draw the lateral process of the malleus. This is the anterior fold of this anterior malleal fold. This is posterior malleal fold. So this is umbo. Draw oblique lines over it and divide it into the four quadrants. Basically first we have to draw a line over this, that pars flaccida and pars tensa. This all is pars tensa and this is pars flaccida. Here we have four quadrants: anterior, superior, this is anterior, this is posterior, superior, inferior, superior, inferior. So basically anterior, superior, anterior, inferior, posterior, superior, posterior, inferior. Done. Anterior, superior. Most anterior superior we have the shed of the eustachian tube. Okay, here we have seen shed of the eustachian tube. In the posterior superior we can see the shed of the incudo-stapedial joint, that is joint formed between the incus and the stapes bone. Next we have the shed of the round window. Okay, so in the anterior inferior portion we have two main important things to learn. First, very important, is cone of light is here. The brightest part of the tympanic membrane is this cone of light, and it is located in the anterior inferior portion. Then second is preferred site for the surgical myrigotomy with grommet incision. We have learned about this in later sessions. Okay. Next is posterior inferior, preferred site for myrigotomy, but without grommet incisions. So it's important. So that's all for today. No, I'm sorry. Next is nerve supply of the external ear, cranial nerves and cervical plexus. So it's how we learn this: A and A. All cranial nerves starts with A. Auricular temporal nerve, Arnold's nerve, auricular branch of the seventh nerve. Seventh is the facial nerve. Okay. Auricular temporal nerve, Arnold's nerve, and auricular branch of the facial nerve. Second is cervical plexus, right? Greater than lesser. Greater auricular, we have studied about the pinna or auricle, and that is greater auricular and lesser occipital nerve. That's all for today's session.